My name is Neda Ratanawongsa. I'm an associate professor at the UCSF Center for Vulnerable Populations in the General Internal Medicine Division. I'm also the Chief Medical Informatics Officer for CareLinkSF, which is our electronic health record system. The power of health information technology has often been that it can help reduce the structural barriers that patients with limited health literacy or limited English proficiency face in any safety net setting or in any healthcare system. So for example, the research by many of the providers and researchers in the Center for Vulnerable Populations has found that patients with limited health literacy experience poor health outcomes and also experience more barriers to their care and to their communication with their providers. I'm a primary care provider, and every day I am impressed by the resilience of the people who are in my patient panel and their caregivers and loved ones. And I struggle to figure out ways to better support them in what they're trying to do for their health and how they navigate the healthcare system. And so my motivation to work in the research areas I do is driven by my Thursday morning clinic, where I see and hear from my patients about what is important to them. Change in healthcare is happening quickly, but at the same time, if change is not based on input from the key stakeholders and from real evaluation at the ground level, then it can leave people behind. So for example, putting in electronic health records, I struggle right now to think about how to meet meaningful use measures that relate to patient portal engagement with a population that in some clinics is 90% non-English speaking, and a patient portal is entirely in English. And we can't meaningfully meet that metric or clinically meaningfully deliver care and engagement to our patients unless we think about shaping the vendors who provide that and shaping the policies about implementing that. So I think the research we do is crucial for saying, hey, let's not move so fast and leave behind the people who are most in need of some of these major changes.